Okay, first I'm going to recite the co-wipe. I'm going to check the patient's orders and allergies, assemble equipment needed for the procedure, wash hands and don gloves, identify the patient using 2 identifiers and introduce myself, provide for privacy, educate, evaluate, and explain. Okay, so we're going to be inserting in G2 today. I have explained the procedure to my patient, identified my patient, and we are ready to start. Well, I'm going to properly position him. And while I was assessing my patient, identified which nair I was going to use. Okay. This part is not necessary, but I don't want to touch the tube with my hands. I just feel like that's dirty. Okay, I'm going to place this on him in case he does, happen to get sick or anything. This is the water that he'll be drinking. Next, I'm going to measure from the tip of the nose to behind the ear to the xiphoid process, and I got 60, so I'm just going to remember that number. Then I'm going to have him tilt his head back, and I'm going to loop the end. Then I'm going to insert this. I'm going to watch. And now I can see it, so I'm going to have him sit forward and start taking sips of the water. And every time he sips, I'm going to advance it a little. And this is as far as the mannequin's going to let me, but I would go until 60, what I measured earlier. And I do not have tape with me, so I would use the chevron to tape this and try to avoid any skin irritation and to prevent the tube from moving in any way. Okay. Next, I'm going to confirm placement with aspirating the stomach contents. Going to slowly, okay, and clamp this so I can measure, assess the color consistency, if anything seems off, the amount. Then I'm going to take this, a little bit of the contents that are on here, dab it onto the pH paper and make sure it is between 1 and 4. I'm going to unclamp this and let gravity take the return back slowly. And then I'm going to go right into suctioning. I'm going to put it on intermittent. It's currently not working, but I will make sure it's between 80 and 120. There we go. Attach. And I would suction according to however long the doctor's order tells me to. And I'm going to measure the amount of secretions color, odor, consistency, amount. If there's any like coffee-like emesis, I'm going to make sure to report that. And then I'm going to document the procedure, clean up, and make sure the patient is feeling okay, and return him to normal position.